patient care has been in the home setting. Well, come on, Lenny. Okay. Hi, buddy. In the home, and more often than not, unfortunately, as a volunteer or for pro bono, even working with agencies. And Glennis has trained countless of others to provide the same kind of loving, comprehensive, responsible professional care. And Glennis has an enormous network of home care providers for people who are homebound because of chronic or acute disease entities or terminal illnesses. So coming home, Glennis will explain to you, kind of spans that population out in the community. And the coming home is a dream of Glennis's that's finally becoming realized and is realized. We've been at it for about 14 months.
Yes.
I mean, practicing it and doing trainings for people. Most of our participants in the trainings are doctors, nurses, mastered leveled people, professionals who are therapists, as well as these caregivers who work full time to earn a living, paltry living that it is, and they come for the training. Because in order to be involved with Coming Home, the training, which is a Saturday and a Sunday, is mandatory, just so you've got all the information, how to channel all that love and capability. So it's we've had authors, poets, Sufis, you name it, boy. There's a lot out there. I've learned more from the people that come to the training than they have from the training.
And they get excellent training because Diane gives it.
Okay.
All right.
This is Glennis. Welcome, Glennis.
Thank you. Okay, well, Diane, you did a great job. It started like 19 years ago. And for me, it started about 25 years ago when my third son, my baby, went off to college to Australia. I was a single mom and an immigrant that came to this country. So he was asked to come to Australia, and I said, oh, Scott, go for it. And my other son was in marine biology school, and he'd been there 5 weeks when he won an award for Best Athlete of the Day, and he was seen jogging home at 8 o'clock at night, and he was mugged by the front door. He must have disturbed a burglar. So I fell in the cracks myself. He was in Australia. He was American but had been born in England. When I arrived at the hospital, I was told to come right away. He was in a coma. And he'd been in a coma, I think, about a month. And lots of ups and downs. He should have died. Then they came to tell me, the head of the hospital, well, we cannot give you any more treatment. His student visa had run out, and he was supposed to go down and renew it and report because the university part wasn't going to begin until September, and this was May, and he'd arrived in April. So as long as his visa and we weren't there legal, we couldn't get any American help, and I couldn't get the British reciprocal help because we were there illegally. And then it became a nightmare, which turned into a very positive thing. I said, okay, I'll do it myself. When he came out of the coma, he could only use one arm, but his character was exactly the same. And he was a fighter. You know, he could fight. So through all the painful exercises he was willing to go through that they'd shown me in the physical therapy, and I didn't know anyone there. I ran up and down the street saying that I would take anybody and train them, even if they wanted to only come 1 hour a month. And I ended up training over 400. And in England, because I got thrown out after 2 years, in England I did the same, and I trained last year of high school students, where 11 went on to be physical therapists, 2 went on to be neurosurgeons, and many went on to be nurses. And they still carry the program out in London and in Wales. So, and in Australia. I'm missing a lot of gaps. You can read it in my book if you like. And then when I came to America, I saw the gaps again. I threw myself into hospice nursing, and I saw many hours where people could not afford to pay because hospice, it's a wonderful organization, but is on call 24 hours, but nobody goes to the home for 12, 15 hours. And if you don't have a backup in your family, then you have to hire somebody. Or if a father of a young mother has to go to work and there's children in the home, they have to pay somebody. And even at that time, we just got $10 an hour. Even that is $240 a day for 24-hour care. And often I saw husbands losing their job, or almost, or the same, wives losing their jobs. So I kept thinking, well, maybe I ought to try and fill in the gaps. And after that, then I worked in the AIDS, with the AIDS doctor here in town, and Diane. And I saw really the gaps then. A lot of those patients didn't have medical care, didn't have any resources, didn't have insurance. So again, I worked for $5 an hour, a lot, except if I was on the staff, and then I made more. And then I started private care, saw the gaps in the system for children with disabilities, hospice, because hospice is my heart too, and brain injured. And I thought, okay, I'm going to try it here. So I started the Coming Home Connection, and I started training people with a lot of nurses' help and Diane's, and doctors, the head cancer doctor, Dr. Tim Lopez. He's my medical director. He said, well, let's try it. Dr. Roger Miller, who is a plastic surgeon and does wound care. He also works with Doctors Without Borders. He said, I'll help you. And there were many people that wanted to be trained. So I started it a little over a year ago, and now I'm up for some funding. And Robert Wood Johnson has just recognized my program. So hopefully they're coming to see me in April. I'm one of 13, and they will pick 9. So that would be wonderful, because I will get a budget where I can hire people to help me organize or oversee everything, because I do need help, and I do need some professional help. Because at the moment, except for one other person, I answer the phone, I go out, do intake, try and keep up with the families, try and call all my volunteers, which there are over 80, and put them in, and they're not free all day or all night either. And then also it creates jobs, because there are people out there that don't know where to go to hire people that are good people, well-trained people. So it works both ways. Let me see what else. I'll tell you a little about some of my patients, like one this week. She's 62 years old. She needs to be on hospice. She can't get on Medicare yet because she's not old enough. She can get on disability, but that takes 6 months.